MAT stands for Muscle Activation Technique. It's a specific non-medical process used to evaluate the muscular system's ability to contract muscle and contract it efficiently. So to explain that a little bit more broad, if you think about how muscles have tightness, we get muscles that are tight. In the terms of MAT, we look at muscle tightness as a form of muscle weakness, right? So you have muscles that become tight due to protecting the instability at a certain joint, right? So for example, if I lift my arm in shoulder flexion, and let's say my right hand can come up this high, but my left hand comes up this high, assuming that we don't have structural damage here due to like injury or any type of rotator cuff injury, I'm going to assume that muscles are tight, and that's why I can't lift my left arm as high as my right. So an MAT specialist like myself would look at muscles that control shoulder flexion, the position that is raising my arm, and we would test muscles around the shoulder that control that motion and make sure that they're contracting and contracting on demand. Once you restore muscle contractile capabilities in shoulder flexion, this arm will be able to lift up higher. So we're talking about how do we increase mobility at a joint while increasing stability at a joint through muscle contraction, right? So it's a very specific process. You look in the body as a whole. I'm looking at a particular patient saying, how does your body move? And we compare that side to side. So once one side is restored and we have equal motion on both sides, we're going to assume that that person is in a protected position, right? So the response would be, I have more range of motion, I have decreased sensitivity in this position, and also maybe if they're an athlete, they would have an increased amount of performance and reduced amount of injury regarding that area, if that makes sense. So really anybody that's cleared medically for exercise protocols would be someone that would be a good fit for MAT. So really any age, any dysfunction would be appropriate as long as a physician or a PT were able to say, hey, this person's ready for an exercise protocol. Let's get them in with you. And particularly for myself, I'm also a trainer. So I would couple MAT with the training as someone came in, but it's usually anybody and everybody, athletes, non-athletes, geriatrics, adolescents, everyone would be appropriate for this process. You would use it as an adjunct to all these other modalities. So you have physical therapy, which physical therapy, they can do a plethora of modalities, but specifically MAT is going to help stabilize the muscular system and stabilize through a joint due to the muscles contracting well. So you're talking about having someone like a massage therapist, a physical therapist, someone that can do dry needling, someone that can do muscle activation techniques, and all these are just different ways and different modalities that we can help our clientele. And really the response to each particular modality may be different person to person. So that's why it's important to have these different alleyways that we can treat people. And so to have an additional method with MAT with someone, we're ensuring that we're giving them all the options that they have in front of them as a clinic and saying, hey, we're going to take care of you. If this isn't something that can help, potentially this other option is something that can help. So it's going to work well within our clinic, and I think that we'll see some really good changes with certain people. I think it kind of ranges with, oh my gosh, as soon as we're done working with the MAT, they feel way better, or it may be a couple days down the road. It just kind of depends on how their muscular system adapts to or responds to that type of stress. So with the MAT, what you're asking the muscle system to do is change the imbalances that we're having due to muscle tightness. And so it can be instant and it can take a couple days. It's a process where initially, once you evaluate someone, you want to work with them probably once a week. If it's severe, maybe twice a week for about 6 to 7 weeks. I've seen some people that I've maybe seen them 2 or 3 times, and then I haven't seen them since, and that's probably because they're just feeling good and they don't feel like they have the need to come in. But someone that is always coming in consistently can benefit a lot from it. So it kind of just ranges person to person, but I would say initially you want to see them once to twice a week for about 6 to 7 weeks, and then we kind of go off what that may do for them in the future. Okay, so right now we're offering an hour and a half free consultation. So that gives myself time to look at that person from a biomechanics standpoint, and also get a quick intake of prior injury history, hobbies, things of that nature. So about 30 minutes taking time to kind of evaluate that part of their life, and then about an hour to do the MAT. So we're making sure that we're getting everything in their corner to really take care of them. And with a full hour, usually that first hour, I'll look at whatever is the biggest cause for concern for that particular patient. So if it's low back pain, if it's muscular related pain, if it's cramping, if it's maybe there's something they want to do and they can't do and they want to try to achieve that. So you'll break it down between lower body, upper body, cervical muscles, and then trunk and spine muscles. So it just kind of depends on where their biggest need is to start, but we're trying to push it forward to say, hey, hour and a half, no charge. We want to show you what this can do for you. So yeah.